Dr. Carl Dieffenbach from the National Institutes of Health shares his observations on the 2015 Conference on Retroviruses and Opportunistic Infections.
Greetings from the last day here at the Conference on Retroviruses and Opportunistic Infections. Today I'd like to talk about two areas. One was we heard one of the more important talks of this meeting from Steve Grinspoon of Harvard University, talking about a critical non-infectious comorbidity, a complication of AIDS that isn't caused by another virus or bacteria. We talked about the importance of cardiovascular disease. Now, cardiovascular disease occurs in HIV positive and HIV negative people and is really exacerbated by smoking and other lifestyle choices. But beyond that, in HIV infected people, there is a level of disease above and beyond what we expect. And his studies clearly showed that we may be able to impact this level of cardiovascular disease using a specific agent, specific drug. To that end, the NIH is launching a clinical trial called Reprieve in the next month or two. Stay tuned. This will be a very important study, and we'll be back to talk to you on AIDS.gov about how you can participate in this trial. Second, as we look forward coming out of CROI, I think it's time to assess what happened at this meeting and figure out how we all can use the tools and the information we heard at this meeting to help attack the epidemic both domestically and internationally. Two themes emerge. First is how we could do a better job using pre-exposure prophylaxis. We've heard some very interesting ideas about how to roll out PrEP and how to use it in the highest risk communities, and how we could potentially improve the uptake and adherence of pre-exposure prophylaxis. The second is tackling and solving the problem of the care continuum. Here we have a situation where the CDC data presented at this meeting is most compelling. 90% of all infections in the United States come from people who don't know their access and are not in the care continuum. This is a major challenge that we all must solve. This has been a pleasure talking to you on AIDS.gov as always. See you at next year's CROI.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit AIDS.gov.